All right. Like Dr. Tamucci said, my name is Jenn deVilleneuve, and I am a family nurse practitioner. I recently started a practice here in Birmingham and Cahaba Heights called Well-Rooted Functional Medicine, and it treats all ages, but I am primarily focusing on children and treating chronic illness from a functional approach. And so, to back up and give a little bit of story before I get into the nutrition that Dr. Tamucci was talking about, kind of the way that I got into functional medicine and a more integrative approach was through my children. So I also was trained traditionally. If you had told me 20 years ago that I would be in functional medicine or even be open to it, I probably would not have believed you. I was very traditionally minded. And it wasn't until my second son was born, and he, as an infant, had a lot of eczema. And so we were treating that, and the first few years of his life, it got progressively worse. He had a number of food allergies, and we were going to the allergist regularly, using steroids, and started to have to increase the strength of the steroids and then the frequency. And then it got to the point where that wasn't really working any longer. And so we were given a prescription for a medication that would suppress his immune system to hopefully keep the eczema in a manageable place. And when I started reading about this medication they gave me, there was a warning about an increased risk for childhood cancer if you use this medicine. And it made me stop then and just ask the question, what are we doing? How has it come to this is our only answer for this? I did not want to give that to my son, but he was miserable, and we were having a really hard time as a family because of it. We weren't sleeping, and so really, as a mom, that made me desperate for answers for him and for help. And so I dove into just doing all the research that I could. I was at the point where things that I might not have considered or been open to before, I was open to because I was desperate. And through a ton of research, I ended up coming across research that was being done at the time on just the connection, the gut-skin connection, and really the connection of our gut health to our overall health. And it was like a light bulb turned on in my head. It made sense. It answered the questions of why is he having these symptoms? Why every time when we retest his allergies is he testing positive to more and more foods, and our list of things that he can't have is growing and getting longer all the time. And yet when I would ask, is there anything causing this? Is there any thing that we can do differently that would help him? The answer was always no. This is just, some kids have allergies, and this is just, it's normal. It's a normal part of childhood. He might outgrow it later. But when I did this research and found out this connection of really nutrition and gut health, I wanted to try it because I was willing to try anything. And so we decided as a family to change our diet. We did not want him to be sitting at the table with the rest of us and not be able to eat anything that we were having. So we decided we'll just try this, give it a try. And we did. And I will say the results were astounding. He was 4 years old at the time. He had not, from the time he was 3 until he was 4, he had not gained any weight. He looked really malnourished. He was very skinny. He had this bloated little belly. He had dark circles under his eyes. It makes me want to cry remembering it. And within the first 2 months of starting this new way of eating, he gained 1 pound, which was significant because he had not gained anything over the past year. And his skin did eventually get better. It was a really long road for that, and there were a lot of ups and downs, and it got worse before it got better. But I will say we were really surprised, not by his healing, because we had really hoped for that and were hopeful that that would happen. But we had my husband and I had some chronic health things, and we didn't anticipate any of that changing. It was random things. My husband had a cyst on his back that he had had for years, that we had checked out. They had said it was benign. And then all of a sudden, several months into this diet, it was gone. And we were like, what? Could this be because of the diet? And then he also had like some warts on his hand, and those were gone. And just some other things too that we noticed that we were like, that was the only thing that had changed. And so it really made me such a believer in nutrition and our health, and not only in keeping us well, but the power of nutrition to reverse chronic illness and diseases. And so that was really the point where I started diving in and learning as much as I could about this, because at different times throughout our family's life, I've had other kids with chronic illnesses, and we have ended up having to go out of state for care at different times, just because there wasn't anybody locally who was really treating things from that approach. And so I always desired that there was that presence here in Birmingham to help other children, because like Dr. Tamucci said, 1 in 2 children now have a chronic illness, and that number has risen significantly in the past 10 to 20 years, and it is still rising. And when you have one chronic illness, you are much more likely to have another, and much more likely to have autoimmune disease later on in life. And so I see the value and the importance of addressing these things in our kids' lives, because it's not only going to help them be more healthy now, but you will set them up on a trajectory for a much more healthy life and lower risk for these chronic illnesses that really are plaguing our country right now. I would say, you know, most Americans in general have nutritional deficits, and our system of looking at labs, you know, I have a lot of patients who will say, well, our pediatrician said our labs are all normal, and there's a difference between normal and optimal. And so that is what I look at, is optimal levels, and how do we get to those levels to help our bodies heal and help our bodies stay well. And so sometimes people ask me, like, what is functional medicine? You hear these terms, functional medicine, integrative medicine, and I'll say 2 things kind of set functional medicine apart. One is we seek to answer the question of, what is the root cause of this? Not treat the symptoms, but really try to find out, why is this going on, and how can we heal that problem instead of just treating the symptoms and making us feel better. Along those lines, that means that treatment often is harder and can be longer, because you're not getting a quick fix. You're not leaving with a medication that's going to take away the symptoms, and it takes a lot of hard work. The other thing that I would say that really sets it apart is that in viewing the body as a whole system and how we were made. And I would say in our traditional medical system, we have specialists that we go to. If I have an issue with my skin, I'm going to the dermatologist. If I have an issue with my heart, I'm going to the cardiologist. And I'm really thankful for that, because that can be super helpful. But a lot of times it's very easy to lose sight of how these systems and organs impact each other. And we are so focused on the one symptom and whatever system that is in, that we forget to look at the body as a whole. And so functional medicine tries to do that, and I've seen the value in that, of seeing my son's healing coming from treating his gut and healing his gut, and then his skin is so much better. His focus in school is so much better. It affects, you know, what we're eating, and our gut health affects so much of our overall health. And so that has made me really passionate about functional medicine, about nutrition. Typically when patients come to see me, nutrition is the first thing that we talk about, because you cannot out-supplement a bad diet. And there's really no point in me giving you a supplement if you're going to continue to eat sugars and things that are inflammatory to our body. So it's really looking at, how can we reduce overall inflammation? And there's different ways to do that, but one of the key foundational ways is through nutrition. So I would love to share more. I will be around afterwards. If anybody has any questions, I'd love to talk, but I'm super excited about this, because our kids are suffering, and our kids are headed on a trajectory of shorter lifespans. This is the first time that our children are having shorter lifespans than the generation ahead of them. So it is a serious issue, and there's so much that can be done to reverse that with educating and empowering parents to change the way that we live. So thank y'all very much.